and moderator of Meet the Press, Chuck Todd.
Hello there, I'm Chuck Todd, and welcome to the Virginia Democratic Governor Candidates Forum, made possible by the Democratic Party of Virginia, NBC4, and Telemundo 44. This forum is airing on NBC stations across the state of Virginia and streaming in the NBC Washington app and Roku and on Apple TV. This governor's race comes at a pivotal moment for the Commonwealth and the nation. The winner of the Democratic primary on June 8th will face Republican nominee Glenn Youngkin. In the next hour, we're going to hear where these 5 candidates stand on critical issues that impact the health, safety, and future of all Virginians. We're going to begin by quickly covering the rules of today's event. The debate will last 1 hour and will begin with 1-minute opening statements from each candidate. Then our panelists and myself will pose questions directly to the candidates. I should note these questions are determined by NBC News and the panelists. They have not been reviewed by the candidates nor the Democratic Party of Virginia or anyone else. Each candidate will have 1 minute to respond, and as moderator, I will reserve the right to follow up or allow rebuttals as needed. The candidates will have a visual notification of their remaining time and when time has expired. We ask the candidates to please adhere to these time limits. There are a lot of you on this stage. Now let's welcome our panelists. News 4 Today anchor Jumi Olabanji, News 4 Northern Virginia Bureau Chief Julie Carey, and Telemundo 44 reporter Alberto Pimienta. All of them join us from NBC4 studios in Washington. And here are the candidates joining us from separate locations. It's Virginia Lieutenant Governor Justin Fairfax, former Governor Terry McAuliffe, State Delegate Lee Carter, former State Delegate Jennifer Carroll Foy, and State Senator Jennifer McClellan. The order of opening statements was determined in a drawing by the candidates. Mr. Fairfax, you are up first. You have 1 minute.
Thank you so much, Chuck, and thank you to all of our great viewers. As you mentioned, this is a pivotal moment in the history of the Commonwealth of Virginia, and now is the time to have a vision that is focused on lifting up all 8.5 million Virginians, something I've been proud to do over the last nearly 4 years as Lieutenant Governor. My proudest day was when I was able to break the ties to expand Medicaid here in Virginia, and today, more than 550,000 more Virginians have health insurance as a result of the work that we've all done together. We've also done record and historic work on criminal justice reform. I've led the way on creating more housing security here in the Commonwealth. And as we come through this COVID-19 pandemic, we understand that there are so many issues of inequality and injustice that we have to face right now in our Commonwealth and also exist around our nation. And so we have put forward the most ambitious plan around education investment, and we look forward to making sure that all Virginians get to rise and thrive coming out of this very difficult period.
Thank you, Mr. Fairfax. Mr. McAuliffe, your 1 minute opening statement.
Virginia has made great progress over the course of the last 8 years. Record investments in education, building the new Virginia economy, healthcare. That's all at risk today. The Republicans have just nominated an extreme right-wing billionaire to be their nominee. And he has pledged to spend $75 million of his own money. And what did this billionaire do right before his nomination? He campaigned all over Virginia with Senator Ted Cruz. Who was his first endorsement after he was nominated? Donald J. Trump. In the first rally he gave after his nomination, he came out to eliminate abortion in Virginia and to put more guns on the street. We've lived through an experiment at the White House with a right-wing billionaire. We've seen the damage that has been done to our country. We cannot let Glenn Youngkin do to Virginia what Donald Trump did to our country. I'm running for governor on a big, bold plan to take Virginia to the next level, to lead this country out of the COVID crisis. It's time to go big, no more tinkering around the edges.
Thank you, Mr. McAuliffe. Mr. Carter, your opening statement.
Thank you so much for tuning in. I'm Lee Carter. I'm proud to have represented the people of the 50th District, that's Manassas and Western Prince William County, for the last 4 years, and I don't come from a normal background for a politician. I'm not a millionaire. I'm not an attorney. I'm an enlisted Marine Corps veteran and an electronics repairman. And I got involved in Virginia politics after I got hurt at work. And I've been fighting tirelessly since day one to make life better for the working people of this Commonwealth, both in and out of the workplace. And we are in a pivotal moment in the history of this Commonwealth, one where we have to decide whether we will return to the status quo, the way things were before COVID-19, where hundreds of thousands of Virginians could not afford to keep a roof over their head and could not afford the health care that their families needed, or if we will transform this Commonwealth into a place where wealth is common, where everyone can live and work and not have to worry about how they're going to put food on the table or make the rent, or whether or not they can afford a doctor or to put their kids through college, or whether they're going to be discriminated against based on who they are, who they love, or who they were born to be.
Thank you, Mr. Carter. Ms. Carol Foy, you're next.
I was born and raised in Petersburg, Virginia. Petersburg is a strong community thanks to the people I grew up with, our faith leaders, my teacher, Sergeant Major Frost, and my grandmother, Mary Lee. People in our community fought to keep Petersburg alive when politicians of the past turned their backs on us. That's why I became a foster mom, a Virginia Military Institute graduate, a public defender, and a legislator who passed bills and budgets to uplift working families and to fight for our communities. And I'm proud to say I was one of the most effective legislators in the House of Delegates, expanding Medicaid to over 500,000 Virginians and leading the fight to pass the Equal Rights Amendment. And as your next governor, I will bring diverse, high-paying jobs to every corner of the Commonwealth, stand with families impacted by police violence, and increase funding for education and teachers. Look, Republicans are hoping we recycle the same old policies and politicians of the past. That's why we need to nominate a new leader with a clear vision and bold ideas to move Virginia forward.
Thank you, Ms. Carol Foy. And finally, Ms. McClellan, your opening statement.
Thank you, Chuck. I believe in the power of state government and the Democratic Party to effect change that solves people's problems and improves their lives. And that's exactly what we need right now. As we navigate COVID and our recovery, we need a nominee who has the experience, but also brings a fresh perspective. And as a working mother, as a Black woman who has seen how our state government has left many communities behind, I have worked to address those problems for the past 15 years. I have more governing experience than any other candidate running for governor, all of them combined. And I've used that experience to lead on addressing climate change, voting rights, expanding voting rights, ratifying the ERA, expanding reproductive health, expanding access to health care. And that is the kind of experience we need, but we need a candidate who will meet Glenn Youngkin and show that Virginians are ready for someone who will not just look to divide us, but bring us together and lead us out of this critical crisis we are in to make Virginia a stronger, more united, and more equitable Commonwealth.
Thank you all, and thank you for sticking to time. Now let's turn to the questions. Later in this debate, we're going to discuss the economy, healthcare, and education. But I do want to start on the topic of vaccinations. Right now, more than 3 million Virginians have been vaccinated against the coronavirus, about 40% of the population, 40. As governor, how would you encourage more Virginians to get vaccinated, especially with the new CDC guidance that indicates vaccinated Americans don't need to wear masks, but you don't know who's been vaccinated yet? And should businesses and the Commonwealth require proof of receiving the vaccine to attend indoor sporting events and concerts and things like that as a way to get more shots in the arms? With the order of this question, Mr. McAuliffe, we'd like you to answer first. 1 minute.
Well, sure. And I think businesses should require to see vaccination cards. Our goal should be to have every individual in America, specifically here, we want them in Virginia, for everybody to get the vaccination. We got to make sure that everybody is safe, and that is the key goal for all of us. As we move forward, I think the state and the federal, and I mean, first of all, I do want to really give congratulations to President Biden for the great work that he has done. We know what we lived through under Donald Trump for 4 years. We know what he did and didn't do on the vaccinations, pretended it didn't even exist. And if you somehow drink Clorox, it'll go away, this horrible COVID-19. I want to give special congratulations to President Biden and Governor Northam for the great job we've done here in the Commonwealth of Virginia. But we need everybody vaccinated. Yesterday was Vaccinate Virginia Day. Now that those older, over the age of 12, they can now get their one vaccination, any one of the three they can get. So let's go ahead. Let's get everybody vaccinated. And I'm all for businesses. If you want to come into my business establishment, I want to see a vaccination because I want to keep my customers safe. Absolutely.
Mr. Carter, same question to you. How would you increase vaccinations?
Well, I think we need to lead by example. So I'm happy to say that I got the Johnson & Johnson vaccine. I am a parent to 4 kids, one of which is less than 3 months old. And so, being able to go out there and get it done, get it, one and done, not have to make multiple appointments, that was incredibly important to me and to my family. But I want to encourage people not to let off the gas. I think that the CDC guidelines saying that, we don't have to wear masks if we're vaccinated. But as you said, Chuck, we don't know who's vaccinated and who's not. I think that was premature. And I think that, frankly, a lot of people are going to try to take advantage of that ambiguity, that fact that nobody knows who's vaccinated and who's not, to try to not wear a mask. But when you do that, when you're not vaccinated and you're not wearing a mask, you're putting people in jeopardy that can't take the vaccine. So all 4 of my kids, they range from 2.5 months to 11 years old. None of them are eligible for the vaccine. Immunocompromised people that can't take the vaccine, people that have allergies to it. So please do your part to make sure everyone is safe.
Thank you, Mr. Carter. Ms. Carol Foy, your answer to this question: how would you increase the vaccination rate?
So millions of families are trying to figure out how to keep their families safe, how to help their children learn while still trying to pay the bills. And as the next governor here in Virginia, I will get shots in arms and people in jobs. I can tell you that I will ensure that there's equitable distribution of the vaccines, where you see some rural communities and predominantly African-American, Latinx, and AAPI community that have not been able to attain the vaccine in an equitable fashion. So I will address that and go directly to those communities, investing in mobile health clinics to meet people where they are, so transportation is not a barrier. Also, we want to ensure that, that people who don't speak English as a predominant language, that we have the information in everyone's native tongue. And so therefore, more people will have access and know where to get it, why it's important. And that's what we need to do, have the information be more accessible. And I will work with our faith leaders, because that's how we effectively and efficiently can distribute information to the people who need it the most. So these are the things that I will do as governor to keep everyone safe.
Thank you, Ms. Carol Foy. Ms. McClellan, how would you up the vaccination rate?
We have to work with our trusted community leaders and have more vaccine clinics in our communities, smaller clinics in areas that people are used to going to, that are easy to get to, making sure that we have information that is easy to understand in multiple languages, making sure that we are removing barriers to access, including the mobile clinics in the rural areas, which have been continuing, but making sure we are meeting people where they are. Our first priority as government is to keep people safe. And if we see that the numbers start going up, that the vaccination rates are going down, the cases are going up, we are going to have to adjust. And we saw with this crisis that our health departments were not mobile and nimble enough to adjust immediately. We've got to address that. And we've got to make sure that people can, if they have to have an appointment, there are multiple ways they can make that appointment, not just going through a computer system that may not work. We've got to be nimble and meet people where they are.
Ms. McClellan, thank you. And Mr. Fairfax, your answer to figuring out how do we increase the vaccination rate?
Well, we have, Chuck, come a very long way and have made tremendous progress. Virginia now has the 7th lowest rate of new infections here in the nation, and we have the lowest number of people admitted to the hospital at any point during this pandemic. And so we need to recognize the work that we've done, but we need to continue to press forward to ensure that we are reaching every part and every community here in the Commonwealth of Virginia. Our critical partnerships in minority communities must continue. We must make the vaccine available on demand to the extent possible. And also working with the private sector, our pharmacy partners and supermarkets and others where people have daily points of contact have been invaluable in terms of ensuring that people have more and equitable access to the vaccine. I also believe that private businesses and the government should require those vaccinations and also encourage people to continue to wear masks and following CDC guidance, but also understanding that we're not out of the woods yet.
Thank you, Mr. Fairfax. Jumie Olabanji has the next question.
Chuck, thank you so much. So we want to talk a little bit about education now. We know nearly all schools across Virginia are now open. Students are back in the classroom at least a few days a week. But virtual learning really took a toll on so many students across the state. In Fairfax County, for example, the percentage of students in middle and high school who earned F grades in at least 2 classes jumped by 83% in the first quarter. So my question is, what needs to be done this summer and next fall to help those students catch up? And please be specific in your answer. We will start this time with Mr. Carter.
I think that we need to directly tackle the inequities that exist in our education funding. We have some localities where parents choose between the best public schools that any locality can offer or choice private schools. And we have other localities where there is no option at all. And all you get is a building that is crumbling down around the students. So the Commonwealth has to step up. We have to massively increase the state share of funding for our K-12 schools, and we have to do that immediately. And beyond that, we have to make sure that those increases in the state share of funding are not limited to one governor's term. If it's just a line item in the budget, that can be undone by the next governor. So we need to make sure that we're amending Virginia's constitution to provide a real guarantee that every student shall receive an equal high quality education as a constitutional mandate that can be enforced by the courts. We currently don't have that, and we need it.
All right, Mr. Carter, thank you. Ms. Carol Foy, if you could answer next.
Absolutely. So I can tell you that as a former elementary substitute teacher, I know that our teachers are overworked and underpaid. And that is exactly why I had a roundtable on education, bringing faculty, staff, administrators, teachers, and parents to the table to address some of our top issues here in Virginia in regards to education. And here's what I heard. We need to address the deficit in learning and the loss of learning that many of our students have. Not only that, many of our kids have been sheltered in place with their abusers. So there's going to be mental health consequences as well. So as governor, what I will do is ensure that we have an extra quarter of school over the summer where our children can go to school and actually be assessed on what is missing in their learning skill set and have it addressed. I will put millions of dollars towards teacher aides in the classroom. I will also fund a Department of Education's recommendation of having one school counselor to every 250 students so we can address our children's mental health as well.
All right, Ms. Carol Foy, thank you so much. Ms. McClellan, if you could answer next.
Yes, as a parent of a kindergartner and a fifth grader in Richmond Public Schools, I have seen that the inequities that were already in our system have been made worse and now are between households, not just zip codes. At a bare minimum, we need to fully implement the Board of Education's recommended standards of quality, which is what they say all of our schools need to provide a high quality education to each child. I've been working with Delegate LaSharice Aird to do that. That is the basis of another candidate's bold plan, but it's frankly not bold, it's old. We need to go farther and make sure that we are not only assessing where the kids are now, providing specific instruction to get there where they need to be, give our localities more flexibility if they need to have year-round school or longer days. We need to make sure we are lifting the cap on support personnel so that mental health professionals, nurses, social workers are back in the building to address the wraparound services needs of our children. And we need to address the crumbling schools by having the state fund again construction and renovation.
Ms. McClellan, thank you. Mr. Fairfax, if you could answer next.
Yes, and the learning loss that we've seen throughout this COVID-19 pandemic is something that must be immediately addressed, but it also harkens to much of the inequality that has existed in our public school system for years and generations. And so I proposed the most transformational intergenerational investment in K-12 public schools in the history of Virginia, called a 40-30-10 plan. We would rebuild and reimagine every public school that's at least 40 years old with a $30 billion investment, and to do so within 10 years. As part of that, we would raise teacher pay above the national average for the first time in the history of Virginia, and also guarantee a summer enrichment opportunity for every young person in Virginia from here going forward. And this would allow our young in the arts, the athletics, and in other fields so that they can year-round have the opportunity to continue to advance their educational pursuits. And I think this is going to be transformational for all of Virginia.
Okay, Mr. Fairfax, thank you for that answer. And finally, Mr. McCullough, if you could answer.
Clearly, with COVID, our children have lost over a year of learning, so we've got to look at summer school, remedial work. But I announced my campaign about education. We need to go big and bold here in Virginia. No more tinkering around the edges. I call for a $2 billion a year investment in education. If you take average teacher pay and compare it to the average pay of Virginians, Virginia ranks 50th out of 50 states. We're dead last. That's a disgrace. And you wonder why we're down 1,100 teachers. Teachers can go to Maryland or Pennsylvania or Delaware today and get $10,000 to $20,000 more a teacher. So let's raise our teacher pay above the national average for the first time ever. I also call for the 40,000 at-risk 3 and 4-year-olds to get them pre-K here in the Commonwealth. I also promise you within 2 years of being governor, I will make sure that every child in Virginia has access to broadband. We need connectivity. How unfair during COVID. Children don't have connectivity, so they got to go to McDonald's to a Wi-Fi hotspot. I will get everybody Wi-Fi. And I will also diversify our educator base. I did this before. I put $1 billion in the last time I was governor, even though I inherited a record deficit. I did it before. I'll do it again. It's time to go big on education.
Thank you for that. Julie Carey has the next question.
And I want to turn to health care now. The pandemic has put a spotlight on the issue of paid sick leave, and many Democrats have campaigned on a promise to deliver it. Yet last session, the General Assembly approved a scaled-down plan that's only for home health care workers. How great a priority would you make paid sick leave for all workers in 2022? And where would you draw the line on which businesses must provide the benefit? Those with more than 5 employees, more than 15, 25 plus, or even bigger? Ms. Carol Foy, we begin with you.
So I can tell you that I believe that healthcare is a right and not a privilege. And I had to, at a young age, make the difficult decision after my grandmother who raised me had a stroke and became a quadriplegic about whether or not we were going to pay for our mortgage to keep a roof over our heads or for the medications keeping my grandmother alive. So I understand intimately the importance of healthcare. And that's why I helped champion paid sick days here in Virginia, but I also carried the legislation to have paid family medical leave. And I would not stop there. I will invest in the reinsurance program to drive down the costs of healthcare, making it more affordable for more people. I will have a prescription drug affordability board that negotiates the cost of of prescription pills and healthcare here in Virginia, saving Virginians millions of dollars and us as a state as well. So that's what it's about. It's also about reducing the Black maternal mortality rate, which I have championed a bill to help pass, and I will protect Roe versus Wade by enshrining it into our Constitution.
Ms. McClellan, you're next.
We have seen with COVID how too many families and too many workers have had to choose between their own health and paying their bills, even those who work for small businesses. And that's why we need to have paid sick days and paid family medical leave for all employees. But we've got to work with our small businesses to make sure they can do that, which is why this session, I was proud to work to create the Community Development Fund to help our SWAM businesses to meet some of these challenges by using low interest loans that can be forgivable under certain circumstances that can be used to help provide paid sick days and to create a insurance program for paid family medical leave so that all workers and all employers can provide it, because our small businesses want to do it. They can't compete with the bigger companies that can provide paid family medical leave or paid sick leave. We've got to help them do it so that no one has to choose between eating and paying their bills or caring for themselves or a family member when they are sick, especially if they put someone else at risk.
Mr. Fairfax.
We have got to ensure that families are able to get back to work safely, that their wages are raised, and that they have the ability to take care of family members in the time, not just of the COVID-19 crisis, but in everyday life. And so we need to ensure that there is paid family leave and paid sick leave. You asked about the level at which that's done. I think to be responsive to the needs of small businesses, we need to look at 25 or more employees and also provide subsidies at state level in the form of tax credits and grants and no and low interest loans to ensure that those small businesses can afford to provide that critical leave, both to get their employees back to work, but also to get our economy jump-started. We in Virginia have had a very strong recovery throughout this COVID-19 pandemic. We went from having 2.5% unemployment right before the beginning of this COVID-19 pandemic to up to 11.3% now today, closer to 5%. this is a critical component of restarting our economy and keeping our families safe.
Mr. McAuliffe, your answer.
Well, it's a great question, Julie, because 41% of Virginians in the private sector do not have any paid sick day. So here we are during a crisis. People get sick, but for many Virginians, they can't afford not to go to work. So do we really want sick people actually going in and infecting their coworkers? Of course not. So I've long argued we need to have paid sick pay, we need to have paid hazard pay, and we need family medical leave. It's critical what we need to do here in the Commonwealth of Virginia on healthcare. We still have 700,000 Virginians without access to healthcare, including 100,000 children. So as governor, what I'll do, the first thing is I'll call my good friend, President Joe Biden. I'll get us a Section 1332 waiver here in the Commonwealth of Virginia, which will allow us to stand up our own reinsurance program, stand up our own state exchange, invest and make sure we're doing more on telehealth. And I will go after the prescription drug companies. The Sunlight Law I will put in place will see these prescription drug prices. But let's be clear, Glenn Youngkin, the Republican nominee, opposed Medicaid expansion. He was against it. He said it was wrong. And for 500,000 Virginians who got health care because of Medicaid expansion, Glenn Youngkin is against it.
And Mr. Carter.
Well, every Virginia worker needs paid sick leave. I would not draw the line anywhere. I think if you are working, then paid sick leave should be a part of your compensation package. But beyond that, we have a healthcare system that is absolutely unconscionable. And COVID-19 really drew out the biggest weakness in it, which is that during a pandemic, when we needed the most people to have health insurance that we could possibly get, hundreds of thousands of Virginians lost their health insurance because they lost their jobs. So I don't think that health insurance should be tied to employment at all. The other four candidates here are all talking about changes they will make while keeping the existing system in place. I am fighting for a universal healthcare system that will guarantee not just access, not just affordability, but real guaranteed healthcare for everyone who needs it. So that when you need to see a doctor, you can go see a doctor regardless of how much is in your wallet or what your job is or whether or not your employer approves.
Thank you, Mr. Carter. For the next question, Alberto Pimienta has it.
We're going to talk about the economy now. According to a report by Old Dominion University, the COVID-19 pandemic wiped out nearly a decade of job gains in Virginia. About half of those jobs have been restored. But what else can you do in order to fully reignite the economy here in the state? We're going to begin with Ms. McClellan.
So this is difficult to answer in just 60 seconds. My full economic recovery plan can be seen on my website at jennifermcclellan.com. But in the short version is we've got to recognize that this crisis was not one size fits all. Our approach cannot be one size fits all. We've got to recognize that our brick and mortar retail, restaurants, hospitality, tourism, people-facing businesses, some of which were already struggling before COVID, are the ones that need the most help getting back on their feet. And we need to make sure that those workers have the resources that they need, including childcare, which is why the first plan I announced was a universal childcare plan, because our workers cannot get back to work if they have nowhere for their children to go. And making sure that they have access to PPE and any health needs that they have met so that they can work as well. We've got to unshackle, continue to let grow solar and clean energy jobs that were put in place with the Clean Economy Act, which I passed, making sure that they are being implemented correctly. But go to my website for the full plan.
Thank you. Mr. Fairfax, your turn.
Yes, as I mentioned, Virginia has had a strong economic recovery coming out of COVID-19 relative to other states, but there's so much more that we can and should do. We need to continue to increase wages to make sure that people who are returning to work can do so, provide for their families. We've raised the minimum wage here in Virginia after more than a decade of it being stagnant at $7.25. It's now at $9.50. I think we should get to $15 an hour and can do so within the next several years. We also have to make sure that businesses, and particularly small and medium-sized businesses, have the access to capital so that those that close can restart and those that have continued to operate can have what they need to get through this period. And so we know at the federal level, the PPP program was instrumental in allowing people to survive and thrive. I think at the state level, we need to have grants no interest loans available. But we also have to continue to track businesses, and that's an investment in education that drives so much of our ability to do so.
Thank you. Mr. McAuliffe?
Well, first of all, I want to thank President Biden for the American Recovery Plan. We will get $10 to $14 billion of monies that will come to the Commonwealth of Virginia to help lift everybody up. And I remind you that Glenn Youngkin said that the stimulus was unnecessary. The same stimulus that will create new jobs here in Virginia, the same stimulus that helped us get the vaccination programs up and running. We need to rebuild our economy. We have 182,000 Virginians who lost their job since COVID started. Listen, I dealt with this before. When I became governor last time, I inherited the largest deficit, created a record 200,000 new jobs. Personal income went up 14%, recruited 1,100 new projects and $20 billion of new capital. I was proud. I wrote the bid to bring Amazon to the Commonwealth of Virginia, Nestle Corporation. We've got to invest in education. That is the absolute key. We got to embed computer science skills, STEM-H, early K through 12. If we build the best education system, we will build a world-class, equitable economy. I did this before during sequestration, the Great Recession. I did it before, and I can do it again. And that's why so many people have endorsed my candidacy for governor.
Mr. Carter?
Well, I tell you what I'm not going to do is I'm not going to give hundreds of millions of dollars of your public money to massive corporations like Amazon and Nestle. When the Amazon HQ2 deal was announced, the rent in my building went up 18% in a month before a single shovel hit the ground, before a single person was hired. It made people's lives worse, and we had to pay for the privilege. Nestle was recently hauled before the Supreme Court, where they argued that they shouldn't be held liable for child slavery in their supply chain. My administration will not subsidize corporations like that. We're not going to be begging billionaires and Wall Street for jobs. We're going to take that money. We're going to put it directly into your hands so that you can create your own employee-owned businesses. That's more than just a job. That's a business that you own, that you operate, that you are in control of, and that is a pillar of your community. We're going to do the hard work of building that sector of Virginia's economy that we own. And we're not going to take shortcuts like begging people like Jeff Bezos to come in here and take our public dollars and pretty please give us some jobs.
Ms. Carol Foy, your turn.
So I think that the economy is part of the question that needs to be asked. Is really also how are we going to make Virginia the best place to live, work, and raise a family? How we're going to help the people who need us the most. And I can tell you that I'm excited and proud to have been a delegate working in General Assembly and with the governor when we were named the #1 place to do business, when we put millions of dollars to our rainy day fund, preserved our AAA bond rating, had one of the lowest unemployment rates in recent history. And I've been honored by the Virginia Chamber for my work. But I also have to say I have more union endorsements than any other candidate who's running, because the people who are building our roads, bridges, painting our schools, our federal government workers stand with me because they know I will stand with them. Fighting to ensure we have paid sick days, paid family medical leave, a true $15 minimum wage. We shore up our unemployment insurance here in Virginia, where some people have been backlogged for months. And so it's about doing the good work to not only ensure that we have millions of dollars towards business grants, free money, but also making investments. Please go to my website, jennifercarolfoy.com, to read more.
Okay. Thank you all. It's been a substantive first half of this candidate forum: education, healthcare, the economy, and the virus. We've gotten through all of that. We're going to do a quick commercial break here, and we're going to come back with more, including a question about policing and racial justice.